Now we will proceed to a big presentation. The presentation will be delivered by Dr. Susan Jung-Su. She's a professor in the School of Nutrition and Health Science in Taipei Medical University, also my colleague. And the topic of this presentation is governing AI nutrition care, from accuracy to human AI collaboration and workforce training. Let's welcome Dr. Zhang.
Let me check my slide. Can you go back to the first one? So, good news. One good news. This is the last speak. And bad news. I'm recovering from my lung inflammation, which has affected my ability to speak. So you have to excuse me for my poor voice in the last 15 minutes. So I'm Susan from Taipei Medical University. Thank you. So let me begin with the first questions. How should we govern, why does AI-supported nutrition care need governance? So my research has focused on understanding the relationship between human and digital technology for more than 10 years. We know that human errors in traditional dietary assessment is not new. It is in textbooks for decades. The major issue is memory. So if I ask you, what did you eat last night? You may need a few seconds to remember. And this is the typical example of so-called recall error. And this error can affect greatly in certain population, like old adults and patients with cognitive decline. And another factor is limited health literacy. Those factors all affect people's ability to report their dietary intake accurately. So in this case, if we will have digital models, like 3D food models, which may help patients understand how much they ate last night. So technology certainly helps. As what just mentioned by Professor Lee, we try to move from the traditional human-centered dietary care to digital technology. The goal for us is to use a digital phenotyping for the future disease prevention. That is the goal. But we have to remember one thing. Even if we move from the traditional human-centered toward technology, human errors are still there. They never disappear. Instead, the introduction of technology introduced a new source of error, which is limited digital literacy, as mentioned just by Professor Sukiyama. If you want to use, that people use like APP or web-based or a direct app, sometimes can be very complicated. So we know that we normally have to educate people to understand how to log into the system. But this is very difficult for old adults or young children. So commercial company has focused their dedication on designing an attractive interface and focus on usability. Of course, usability is the first key in order to encourage people to adopt the digital tools. But companies tend to forget the key issue is the underlying nutrient database that made the technology work. So if I give you an example, if you enter a food breaker using my Fitness Pal, which is the #1 diet tracking app in the App Store. If you enter the food breaker using English, traditional Chinese, or Vietnamese, you will get different nutrient outcome, particularly in micronutrients, in which the regional MyFitnessPal app will yield less accurate micronutrient result compared to the English version. So this just reminds us, technology has its limitation. But when we introduce the AI-supported nutrition care, this also introduced another areas. So to summarize from today's all prestigious words, we know that a good digital tools, sometimes we are too ambitious and we want more in one go. But this can make a system too complicated for people to use. And so designing a technology is one thing. We have to remember how to engage and retain user for the long-term usage is another issue. So this issue will be less problematic when we move to the AI, because when we move to the large language model, this relies on the AI chatbot. So in my opinion, the error would be human-AI interaction error in the future. So let me show you an example from our recent study from the American Journal of Clinical Nutrition. So we built a multi-model AI called Double AI, and we integrate to nutrition practical codes and teach students how to photographer a standardized food image and how to work with AI for automatic food image dietary analysis using real-life dietary record. But due to the time limitation, I won't be able to show you the accuracy or consistency of the AI download. Instead, I focus on data relevant to today's talk, which is where do errors come from? So we noticed that errors are not only coming from AI model itself, but equally important is the technical problems during the human-AI interface. So if at the human level, if this is the image-based dietary record, the quality of the food image remains the key issue. So if user does not photograph their meal properly, this not only affects human analyzer's ability to identify the food items from image, but also AI's ability to identify food items. At the AI level, I think that it is not only the model is important. Of course, model is important, but equally important is technical problems. And that time when we did this study was almost 2 years ago. We encountered a severe problems of system overload. And these technical problems never goes away. And like a context window limitation still here, and it's affect AI performance profoundly. But I'm afraid just few people aware they are encountered these technical problems. We also noticed that AI also share the similar limitation as traditional dietary assessment, which means AI, similar like human, they tend to underestimate energy and macronutrient, especially like a carbohydrate, fat, because AI tend to omit invisible ingredients like cooking oils, sugars, and condiments. So AI also shares the same limitation as traditional dietary assessment method. But thankfully, I think most of the AI problems are able to correct it or partially correct it during human-AI interaction. For example, about this requires a human analyzer has sufficient AI literacy. So they are able to identify the technical problems when they co-work with AI, and in order to fix these problems, rather than just keep input and input, then the AI output is not good, then they just say, oh, AI is rubbish. So this is the wrong mentality, because they don't have sufficient knowledge of the technical issues occur. And also, they need to follow a specific workflow in order to stabilize the AI's output consistently. So take-home message is, if we want to govern AI-supported dietary assessment, we cannot govern only the AI model. We need to govern the entire human-AI workflow. So as AI becomes capable, how should we prepare the nutrition workforce for the AI era? I constantly observed a gap between what scientific evidence tells us and what professionals believe. For example, papers tell us that AI model is able to pass medical licensing exam or registered dietitian exam, but medical students or professionals, they perceive AI as inaccurate and distrust AI. If you gather the recent evidence together, you should already know there is no longer an issue to argue that how accurate is AI. It is more accurate than professionals. But we have to understand is what influences people's willingness to use AI or any digital tools. So we conducted a study at Taipei Medical University among nutrition dietetic students. So we found that trust predicts the actual use of AI chatbots as actual nutrition assistance. So if students do not trust AI chatbot, they won't co-learning with AI to prepare for their registered dietitian exam or use AI chatbot to assist dietary analysis. But trust should not be blind. So we should educate students to develop calibrated trust. Teach them knowing when to trust AI and when to verify AI output and when to rely on human judgment. So people often ask, what can AI do? And then we start get frightened by AI because of the capability of AI is improving dramatically. So we worry that our jobs will be replaced by AI in the future. But I think the most important question we have to ask ourselves is, what do humans still need to do? We know that AI is capable of generating answers quickly, organize large amount of data efficiently, which are all better than human. But we have to remind ourselves, it is human work around AI. It is human should provide clear context, verify AI output, and make the final judgment. So in other words, it is human in the loop. You hear human in the loop often in this yesterday and today's conference. Human in the loop indicates that you cannot just ask one question to AI and AI output its answer that does not. No. If you want to get the best performance of AI, especially to do a professional task, human in the loop is the key. So I think we should remember we all use literally the same foundation AI, but it is people who make the difference. So I believe that human AI competencies require AI literacy and training. So currently we are conducting a cross-Asia survey to measure the AI readiness and training needs among nutrition and healthcare professionals. So, future perspective. When I received this invitation, I feel honored. But as a researcher and educator, I also ask myself, how should we govern AI-supported nutrition care? So based on my research and large broad literature evidence, I think we should govern at this three level. The first level is human governance, which is where most of my research has focused so far. Professionals should have the competence to work with AI while retaining final professional judgment. But competence does not come in 1 minute. It requires a thorough training as well. The second is technology governance, which is my next goal if I'm able to recover from my lung information. So AI systems should be reliable, properly evaluated, and supported by appropriate safety, privacy, and audit safeguards. So governments and institutions need provide clear policies that define how AI can be used, what is the boundary, and who is accountable, and what safeguards are required. So in other words, safe AI-supported nutrition care depends on responsible humans, trustworthy technology, and accountable system. So to conclude, I believe that governments and healthcare institutions should invest in three priorities. First, validate. Validate AI in local clinical settings, rather than relying on benchmark performance. For example, we need to test AI tools with local patient population and evaluate in real-world clinical workflow. Second, govern. I believe that we should govern the entire human AI workflow, not only the AI model. And we should provide appropriate human oversight and take multiple safeguards and institutional accountability. Finally, education, which is, I feel strongly, that we should prepare the future workforce through AI literacy and human AI collaboration trainings. We cannot then just use AI without any training or guidance, because this AI model is built as a foundation model, not built for a particular professional task. So the future of nutrition care is not about choosing between humans and AI. It is about enabling human and AI to work together safely, effectively, and responsibly. So lastly, I would like to thank my students, and some of them are here, and also my collaborators. Without them, this work wouldn't have been possible. And thank you so much for your attention.
Thank you so much for your wonderful talk.